Did you get a piercing or a tattoo that no longer looks like a piercing or a tattoo? Your skin is growing stuff. Or did you get an incision from a surgery, or just a cut or a wound from stepping on a stick or falling down and scraping your knees? And did your skin heal in a very particular way? Well, if your skin looks something like this could be a keloid scar. This is a very unique type of scar that is actually caused by an overproduction of collagen deep within your skin. Collagen is that thing we're always talking about, the most abundant protein in our body that we want more of in our skin because it is strong, and along with elastin, it's stretchy and it helps us look youthful and wrinkle-free, right? Well, there can be too much of a good thing. And in the case of keloid scars, this can be really bothersome and even painful for some people. Now, keloids need to be diagnosed by a dermatologist because they can look very similar to hypertrophic scars. Now, what's the difference? Well, both of these scars are actually an overproduction of skin tissue deep within the skin, but hypertrophic scars really stay to the border of where the wound or the incision or the thing happened, whereas keloid scars tend to go outside of that border. They grow and they continue growing, they continue growing, and they continue growing. They can feel kind of spongy and soft sometimes, a little bit malleable, or they can feel really thick. And especially if these keloid scars are over joints, especially kind of on the back of the neck, it can actually really limit mobility, especially if they become these large plaques, which can be not only difficult to deal with because of mobility, but people might not like the aesthetics, and sometimes they can even itch or hurt. Now, keloid scars can happen to anyone as long as you've got skin, but some people are more prone to them due to their genetics or even their race. About 1 out of 5, or around 20% of African Americans do get keloid scars, but these also happen in Asian populations and Caucasian populations. Anyone can get them, and they can be equally as distressing. While there appears to be a genetic component to keloid scars, sometimes they happen idiopathically, basically without explanation. It's just this spontaneous keloid scar that shows up. Sometimes these happen where the skin is stretched, such as on the chest, the back, and the neck, but most often keloid scars happen after some sort of trauma or some sort of wound, whether it's an incision from a surgery, a piercing, such as with body jewelry and body modification, or even tattoos. And some experts wonder, is this an immune system response that's causing this to happen, or are these just overactive fibroblasts, the little cells that are responsible for making this collagen tissue in the first place? It's not 100% known, but this is also why it's so important to see a doctor or a dermatologist to make sure that 1, it is actually a keloid scar, and number 2, what are your best options for treating it? Now, a lot of people want keloid treatment options at home, and this is so difficult because there's really nothing that can be used over the counter that's going to make a major difference. But there are things that you can do at home to help, especially right after getting a piercing or a tattoo or a wound, that can help increase your chances of the wound healing normally and try to prevent keloid scars from forming or getting much worse than they could. Now, some of these options at home include things like scar sheets or keeping wounds really clean and sterile, especially around the ears where there can be a lot of bacteria, or tattoos that sometimes get a little bit irritated. But if you do see a doctor or a dermatologist, there are some amazing things that can be really helpful but might not be right for everyone. For example, some doctors and dermatologists actually inject steroids into a keloid scar to either help decrease it in size or prevent it from further growing. There are things like cortisone or triamcinolone injections, which can be really, really helpful because steroids thin the skin. And if the issue here is this collagen overproducing inside the skin really deep in those layers, injecting a steroid right into there and having it break down that fibrous tissue can be super helpful. Now, there's also things called scar revision surgery, but for keloids, this isn't always the best option. And the reason why is because if someone is prone to keloids and they keloid after an incision or a wound or from skin being pulled tight, can you imagine cutting a keloid out just to tighten up and stitch up the skin? You could be just causing that issue again. Now, unfortunately, for those who do get their keloids surgically removed, it usually has an 80+% of coming back. But if things are done correctly by a licensed provider who knows what they're doing, a skin surgeon, a dermatologist, and post-care with things such as steroids or with compression dressings is used, then that can be much better. In the derm clinic, there's also things like laser, specifically pulse dye laser, or even different forms of radiation. There are many different treatments that your doctor or derm can speak to you about, and depending on your keloid scar, kind of where it is and how aesthetically versus physically uncomfortable it is for you, you can come up with a treatment plan that works. Now, what about at-home care? There are things that you can do, but your doctor or derm needs to advise and prescribe these things, such as at-home steroids. Now, at-home steroids are a great option, especially if you have like a lot of itching or the keloid scar and lesion is kind of burning and frustrating you. But unfortunately, whenever you're applying something topically, basically on top of the skin, that cream can't really penetrate into that thick keloid scar as well as it should. If we actually look at a beautiful histology slide of a keloid scar, this is basically a sample of keloid scar skin tissue underneath a microscope. It is gorgeous, but you can see how thick these little pink specks are. This is dense fibrous tissue. This is collagen, and getting a topical product to penetrate into that can be really difficult. If your keloid scar is itching, think then topical steroids can be amazing, and in combination with like a scar revision surgery or a laser, this might be a great option for you. But of course, steroids, at least over here, are prescription only. So you need to make sure that you're getting a prescription for that and getting advice on how to apply it and when to stop, because you don't want to overuse a steroid. Now, one of the best things that you can do at home, especially right after you get a tattoo or a piercing or a wound or any incision from surgery or otherwise, is actually applying a silicone pressure dressing. These pressure dressings actually work very well, and if you go into a professional office, they're probably going to advise you to use a pressure dressing along with some of the other things that are recommended. Now, these silicone scar sheets come in all sorts of different sizes, and they're super great, especially if you have a large area of skin that has, you know, a very uncomfortable keloid scar. You can literally stretch this pressure dressing over it, and it basically helps to push this raised keloid into the skin and prevent it from growing further. Now, the unfortunate thing is that these need to be worn for like half a day, if not all day, for multiple months, and it's best to do this right after the wound or the surgery or the incision or the piercing or the tattoo happens. And a lot of people just don't know about that, especially if they're getting pierced or tattooed by someone who's never experienced their customer keloid scarring. But knowing this and going into your tattoo or piercing place and being able to care for the piercing, the tattoo, or even an incision after is really important. And of course, that includes making sure that things are clean. A lot of people tend to get earlobe keloids, which can really be painful. They can happen on the back of the ear. They can even happen on the back of the neck if you're prone to acne. There's basically a type of keloid scar that happens in the hair follicle, similar to a pimple, but it's not a pimple with acne, it's an actual scar. And those can be super painful, like on the back of the neck. But if you keep the area clean and sterile, not only is it better for preventing infection, but it could actually prevent keloid scars and make it easier for something like a pressure dressing to adhere. Now, there are specific tools and devices that can actually apply pressure to earlobes. Some people I've heard even use binder clips. This has actually been reported on before, but there are also other things that you can do just to apply pressure to those areas. And the biggest thing is that you want to remember to stay consistent with these. And then if you have a topical steroid that you've been approved to use over the counter, that's something you might want to go for as well. As mentioned, there are other things such as liquid nitrogen or cryotherapy, where basically super cold liquid nitrogen is shot at the skin. That can be very helpful, especially for small areas, but these need to be done by a doctor or a derm. And a lot of these things can't always be done at home. So what can you do? Obviously get it diagnosed correctly, see a doctor, a derm, or an expert, and also know what you're getting into. If your body is prone to it, prepare ahead of time. Make sure that any incision area, piercing area, tattoo area is super clean, and actually get some of those silicone scar sheets or pressure dressings before you go in if you're worried about keloiding. Of course, make an appointment with a doctor or a derm who can really help advise you. And if you've had a keloid for a very long amount of time that just keeps getting larger and more uncomfortable, you may want to look at something like a revision surgery or a pulse dye laser or cryotherapy or any of these other modalities that are available. Keloid scars can be really uncomfortable, but they are not impossible to treat. There are actually some experts who are focused on treating keloid scars and have gotten near full recoveries, which are amazing. And I want you to remember that hope is not lost. First off, what you look like does not dictate what you can do for this world. And if you need some inspiration, there are some gorgeous people who actually embrace their keloids. They use them as art. We've actually interviewed and done a couple of blog posts on these people and their stories. And if you'd like to check out these people on CassandraBankson.com, you can read their stories or even follow them on Instagram. But I think just seeing other people embrace their skin conditions can help us understand that this isn't something to hate or to fear about ourselves. And if you want to revise a scar or try to treat it, you can. But if you want to embrace it or even bedazzle it and cover it in glitter and love it, you absolutely can too. If you have your own keloid story, please leave it in the comments below. And I've also linked a couple of the silicone scar sheets right here for you to check out. But overall, do remember that what you look like has no impact on what you can do for this world. Go back and listen to that again. Always remember to stay hydrated, both orally and topically. Remember to reapply that SPF, which yes, should be reapplied over keloid scars, and always be beautiful both inside and out. I love you, and I can't wait to see you in this next video. Love you guys. Bye.